That's particularly important to identify which side of the vision will be affected later on. So we're going to talk about the lesions at the end of the optic nerve, but particularly important to know now that the fibers on both nasal side will cross to the opposite side. Very good. So talking about optic chiasm. So optic chiasm, it's the union between the two optic nerve on both sides. You can identify here, this is the chiasm, and it's basically the union between the two optic nerves on both sides. They are present on the floor of the third ventricle. That's the third ventricle, and it's present on the floor of the third ventricle. The anterolateral angle is continuous with the optic nerve, and the posterolateral angle is continuous with the optic tract. And we talked about the crossing of fibers. You can see here as well, the fibers on the nasal side, on both sides, in the nasal side of the eye, they cross to the opposite direction. And the fibers on the temporal side, they don't really cross to the others, but they continue on the same manner. So let's go back. So the junction between the anterior wall, it's present at the junction of the anterior wall and the floor of the third ventricle. Its anterolateral angle is continuous with the optic nerve, and posterolateral angle is continuous with the optic tract.